I'm Dr. Winnie King. I'm an emergency medicine physician, and I'm an owner and managing partner for Priority Emergency Room. The Zika virus is not a new virus. It's been around for quite a while. The World Health Association has been aware of this virus in parts of Africa and Southeast Asia for quite a number of years. It's a virus that when a person is bitten by an infected mosquito can cause symptoms such as body aches, fever, redness of the eyes, and it tends to be a self-limited infection in most people. It's really not a big concern. Many people will become infected and not even realize that they were sick. It's just a few people that may get really sick from it, and that's the reason for the concern. Something really interesting about this virus is that we've been able to isolate the virus in semen of men who've become infected. And that's not typically what you see with a viral infection. And because of that, if a man were to have sexual relations with another person, that virus could then be transmitted to that person. And we've seen that happen. And as a matter of fact, just recently, the CDC is looking into 14 cases here in the US where someone contracted the virus and they believed that it was a sexually transmitted infection. I think it's important to take all of this and put it in perspective. It's not unusual every so many years that we hear about a new virus, and of course it causes some degree of public panic. But the truth is, most people, if they become infected with Zika, will not become seriously ill. Now, there is a subset of people that we are concerned about, and that's pregnant women. We're worried because it seems, at least in South America, particularly in Brazil, that women who became infected with this virus, who were pregnant, went on to give birth to children who had very small heads and brains, microencephaly. And that's concerning. And so we worry that any woman who's pregnant who becomes infected could, in fact, go on to deliver a child that has that type of a birth defect. If you are at extremes of age, if you are a very young child, if you are a senior, of course, any type of infection has the potential for being more serious with you. But any person who's in reasonably good health, takes care of themselves, and doesn't have any very serious comorbid or chronic health problems, will either not even know that they got sick, or if they do, it's a very mild infection. Usually it's gone within a week. They may feel achy, sort of like they had the flu. They may have some redness, to their eyes, a conjunctivis type look. If you ever have a concern, you can always go to your physician and have it checked out. But most of the time, it's really a matter of what we call palliative care, meaning that we'll give you a medicine to make you feel better. Acetaminophen products are great for this. In particular, you should stay away from aspirin and other what we call non-steroidal anti-inflammatory medicines like ibuprofen. Those can sometimes make this a little worse. And there is a very small risk of something called Guillain-Barre Syndrome. And this is rather unusual, but they're starting to connect this to some people who have been infected with the Zika virus down in South America. This is when your immune system attacks some of the nerve cells in your body, and it results in weakness of your muscles, even paralysis. They've seen that in a few people, and they're starting to think that maybe the increase they're seeing is connected to people being infected with the Zika virus. The good news, though, with that is that the vast majority of people, while they do need medical care, will completely recover. It's only a very small number of people who will go on to have long-term problems. So I guess if there's one thing that I want people to know is that they shouldn't panic. That this is a virus of one of many that we will see in our lifetime that come along. It's not a new virus, it's just new to us, but it's been around for quite a while. The World Health Association is very aware of it, they've been monitoring it. This is really more a function of our mobile society, that something that can be in Africa can in a few hours be in the US or in South America because we travel so much. And that air travel really makes it easy for us to spread infections. And so it's not new, it's just new to us, and most people will do just fine. But if you ever have a question, by all means, see your doctor. It's very concerning when you hear about pregnant women having children born with birth defects who are infected with Zika, particularly in the first part of their pregnancy. And so, of course, there are women who are not pregnant now, but are wondering, if I were to contract Zika, would that mean that if I got pregnant a year or two down the road, would I still have the risk of delivering a child that had that problem? The answer is that no, we don't believe so. It's an infection, and so it has a beginning, a middle, and an end. And then after that, you are no longer infected, and so the effect of that virus would then no longer affect your pregnancy. In fact, interestingly enough, we believe that once you've been infected, you do develop antibodies so that you may have some immunity to becoming infected down the road. But in terms of being concerned about something that could happen a year or two from now if you were to become pregnant, no, it doesn't appear that there's any significant risk for that. A lot of people go through life and they don't really see their doctor because they feel good, you know, and they just don't feel the need to go see their primary care doctor. And it's times like this when something happens where there's something in the news about a virus that's potentially serious that people get very frightened, and then they don't know where to go because they really hadn't been seeing their doctor up till this point. It's always a great idea to maintain a healthy relationship with your primary care doctor. You never know when something comes up and you need to have some good sound advice, and that's where going to a primary care would be extremely important. But always know that if for some reason you can't see your primary care physician, or let's say you get sick in the late evening or early morning hours, you can always come to an emergency room. They're open 24 hours a day, and they can intervene and help you get well or point you to the right place and make sure that you're not seriously ill. We don't want you to sit at home because you don't have a primary care. We'll take care of the problem, and then we'll get you on to a primary care doctor.